Hi there, Abby. We're just waiting for the other person's audio to connect. So
Great.
it looks like it's just dragging for a moment. Hi there. So welcome. We are very happy to have you joining us. I'm Dr. Jennifer Fisher, and this is Dr. Linda Johnson, and we are the two specialty directors for the Women's Health Nurse Practitioner program here at CU. Anna Pin is here from admissions, so she is going to go over a lot of those pieces. Just to let you know, we are recording this. This is only for us to have the opportunity to share this webinar for people that couldn't attend, like you guys get to attend live. We certainly want you to ask questions. We know that if you are probably not the only person who has a question. So please don't hesitate to ask us. We want this to be very helpful for you and that you feel like you're leaving having a clearer sense about not only this program, but applying to CU's College of Nursing for your graduate studies. Okay. Um, so, Dr. Johnson, do you want to share just a quick little blurb about yourself?
Sure. Well, I am an assistant professor and I am co-specialty director of the Women's Health Program along with Dr. Jennifer Fisher. And we are a team 150% of the time. And we really strive to make a top-notch women's health nurse practitioner program for you. I've been with the university since 2015. I graduated with my master's and my doctorate in nursing practice with the University of Colorado Health Sciences Center and then Anschutz Medical Campus. And I have been a women's health nurse practitioner, oh my goodness, since I would say over 30 years. I
Yes.
was thinking about like the years I've done this.
Yes,
So,
you
yeah,
were an advanced practice registered nurse in this arena before it was as full as a women's health NP exists today. So you
yeah,
started.
I've kind of come up through the ranks, so to speak, in nursing. I started out as an LPN and graduated in 1976. And then soon knew I needed to go back to school right away and get my RN, which in the 80s, the associate degree programs were very popular. And so I went that route and then became a clinic manager for Planned Parenthood right away and went through their certificate nurse family planning nurse practitioner program at the time. And for years, I was precepting students and I did not have my master's degree. And so I had a student that was walking out after working with me, and I taught her all my pearls. And I just said, I have to get back to school because she was going to get her master's degree, and I didn't have my master's degree. So I found a statistics teacher who was she said, I always work with nurses who are afraid of their math books. And that just gave me the confidence to get back to school. And so I got my master's, gosh, in 2003, said I would never go back to school again. And 10 years later, I applied for the doctorate program. So then graduated, helped out with a skills course, and then was so grateful to be able to become a part of the Women's Health Nurse Practitioner program here at the University of Colorado. So, and I have the pleasure of helping educate our next generation of women's health NPs.
Which is super exciting right now because we're getting wonderful feedback from all of our new graduates who have just passed boards. So that is something we will talk about as
Yeah.
well with you all. So we have a very high pass rate for our certification exams and and that's one of the things that we're very excited to be getting that feedback right now from all of the students saying, yay, they've passed. I am a second degree nurse. My background is actually in business and marketing. And I went back to school, kind of got called, my heart pulled me to go back and become a nurse. I was inspired and continue to be inspired by my mom, who was the best nurse ever. And she really encouraged me to kind of follow that dream. So I pursued a program that doesn't exist anymore, but it was basically like the master's entry, if you would, like the master's RN entry to practice program. It was a doctoral program, but then I stayed with the university. I'm a university lifer. I have worked here clinically as well as academically my whole career and did diabetes, pediatric diabetes education, as well as clinical research trials. So my background has been academic for a long time from the School of Medicine and now here in the College of Nursing. And so then I went back and got my MS and specialized in women's health, and then also completed my doctorate in 2009. So I was one of the first waves of the DNP. And we'll talk a little bit about that because our institution is still an institution that grants MS as well as BS to DNP. So that will become important, and Anna Penn will also touch on that in terms of making that admissions decision. You of course can decide to matriculate into a DNP program later. However, you do have to pick when you're submitting that first application. Yes, so I have been actually very privileged to work with Linda since I came to the university or the College of Nursing, which I did in 2016. And we have been working together pretty much ever since. And I think really play off of each other's expertise. And I bow down to her clinical skills 100%. And I've been able to focus a little bit more on curricular development and ideally expanding kind of how we're teaching you to become the best nurse practitioner and ideally doctorally prepared learner as well. So Anna Penn, would you advance? You are so kind to be our slide guru today as well. And they so kindly helped us too, making our slide deck far more branded appropriately, first of all, and visually stunning. So thank you so much for that.
You're welcome. Yeah. It looks like I'm having some technical issues here where it's not moving for me.
Do you want me to try from my end?
Could you please? I
yes,
apologize.
It'll take me just a second to open.
So while Dr. Fisher is working on that, I'll give you a little rundown on my clinical experience. So like I said, I came to Colorado as an RN, and I worked at Presbyterian St. Luke's Children's Level 2 Nursery. And then in that meantime, went to work for Planned Parenthood, became a clinic manager, and went through their certificate program. Well, I ended up working for Planned Parenthood for 13 years, and I developed the float team for them, and which is still going today. And I'm very proud of that. And then I just felt like I really had to get out in the community and see what else was available. So I wanted to see what the private practice sector was like. And I went to work for a very small private practice. Dr. Douglas Kirkpatrick, worked for him for a few years, went to a very large OBGYN practice, which is Westside Women's Care, and really learned how to be on time with all my visits, because it was a sort of practice, if you got 10 minutes behind, your day was wrecked, and learned how to dictate at that time. Then the city and county of Broomfield was becoming a county. And so I helped them develop their reproductive health program there, and did that for a few years, I think 5 years. and then went down to Boulder Valley Women's Health Clinic and was the clinical director there for 7 years before coming to the university. So I've seen a lot of trends go up and down in women's health, but there are a lot of things that are very stable and that we continue to focus on and teach, but our guidelines are always changing. So that is one of our challenges, is to keep up with the latest and greatest for you.
Yeah. Yeah. So with our time, and we promise we will, if you quickly like to introduce yourselves, we can do that since you're here with us. Abby, we can see you. So if you just want to say hello and tell us a little bit about yourself.
Yeah, hi, I'm Abby. I am born and raised in Colorado, and I've been a nurse for about 6.5-ish years. I started off just doing medical oncology, and always knew I wanted to go into some sort of women's health, and labor and delivery was kind of like my desire, but I kind of had to start as a new grad with where they would, let me. And then I ended up moving to labor and delivery at Rose Medical Center for about 2.5 years. And then just needed kind of a pace that was a little slower than the hospital. And I now work in a functional medicine clinic as one of their lead nurses and IV specialists. And so I don't get to do as much with women's health as I would like, but I've kind of learned that the clinic setting is kind of where I'm drawn to and interested in for just teaching women and kind of being a part of that in the clinic setting and educating and all of that stuff. So yeah.
Great. Thank you, Abby.
Yeah.
And yes, you can go ahead.
Hi. Can you hear me okay?
Yeah.
Looks like it's connecting to audio. Okay. My name is Catherine. I have been a nurse for about 5 years now, and I started off in med surg and then moved along to critical care, and then had always kind of had a heart for labor and delivery, was a doula before becoming a nurse. And so now I'm in labor and delivery and interested in expanding my practice kind of in the hormones spectrum. I just think that there's such a need for kind of this like 35 to 55-year-olds. I think that there's, it's kind of an underserved area, and a lot of women are having babies later in life. They're needing to balance their hormones, or they're done having babies. They don't know what's going on with their hormones, or, they're entering into perimenopause and menopause. And it just feels like, at least speaking from experience and to my friends, they just don't really know where to turn. And I find it fascinating. And so it seems like that would be, a great next step in terms of my career and helping women navigate that whole area. So that's kind of what I'm interested in, and here to just learn a little bit more.
Okay. Well, thank you. Yes,
Yeah.
Dr. Johnson definitely has a lot of expertise in that area as well. So
yeah.
So what we're going to do here is we're going to talk a little bit about the program plans themselves. And then the advising bullet relates to the fact that as you enter the admissions process, the advising on that really comes from Mark and our admissions specialists. And then we're here to support you, certainly once you matriculate as a learner, At that point, we become your advisors. Admissions is very critical if you're, well, one, if you have any questions about the process, but also interested in transferring credit if you've taken classes elsewhere. We do allow certain things to transfer, but not necessarily everything, depending on what you've done at a different institution. And that's where, again, we are in close partnership with the admissions group because they really support all of those pieces. And again, Annapin is going to speak more to that shortly. But a little bit, again, around when you're applying and seeing those deadlines, you will need to decide if you're going to apply to the MS program or to the BSDMP. And we will not go 100% into that, but it is important for you to understand our national climate around the doctorally prepared nurse. As happens with nursing, we say one thing and we sometimes do another in the licensing world and in the academic world. And so nationally, organizations have got behind the Doctor of Nursing practice as the encouraged, if you would, entry level to advanced practice registered nursing. However, the logistics of that haven't quite rolled out uniformly. So we are an institution that grants both an MS as well as a BSDMP. There are other institutions in our country that do not confer both of those degrees. You either come into a DNP path, you do an MS, that sort of thing. So one of the things that we ask you in an admissions process is, do you really understand what you're applying for? Right? Like, have you done the homework? And so this resource slide, NCC and NPWH are great places to go to. NCC is the certifier, the person who actually, the group that actually administers your board exam. NPWH is our organizing body of nurse practitioners and women's health. They set our scope of practice, our, kind of like what needs to be covered in education. And so those two things are two resources, if you will, organizations are very integral to kind of understanding what you can do as a women's health nurse practitioner, what you can't do. Okay, so you are a primary care provider as a women's health nurse practitioner. You are not just boobs and tubes, is what a faculty member said to me long ago. You look at this whole person, and a person with a uterus and breast tissue also has a heart and lungs and all of the rest of the organs that make you function as a human. And so we do provide primary care to assigned females at birth for common, non-complex conditions. Okay. Of course, then we are specialists in sexual and reproductive health to all persons. And that has always been very exciting to me, and that we are concerned about the sexual and reproductive health of assigned males as well as assigned females. It's not, yes, right now, women's is in our name, and there are institutions and across the country that have started to have a more inclusive title. Unfortunately, it ends up being really long. It's like women's health and gender affirming care nurse practitioner. So we're not quite sure where that's going to shake out. Dr. Johnson and I have had lots of conversations about what we would like if we could wave a magic wand, but that won't just be up to us. I would say there is, quite a strong possibility that what that title is, kind of the WHNP may evolve in the very near future to better represent the populations that we serve. And so I'm going to stop sharing this for just a moment, and I'm going to grab one of those program plans to show you briefly. And these are available on our website, which is incredibly helpful.
Yeah.
All right, let's see. I've got it up so I can share again. All right, so first we're just going to show the master's program, and then I'll toggle over to the BS to DNP, because the BS DNP has all of this and then the specific doctoral work that is beyond, if you will, okay? We divide our program conceptually into the core and then your specialty work. So the core starts with just exactly what we would think: advanced pathophysiology, foundations of healthcare informatics, and theory. And yes, you really do use theory. I know sometimes people are like, theory does not drive my practice. It underpins your practice. And so we really want you to have a theoretical understanding in nursing to support how you want to become an advanced practice registered nurse and the care that you want to provide. So your first year is mainly core, okay? The one exception to that is this reproductive physiology course that's taught only in the spring of what would be your year one. So the other program plan we have, which is spring matriculation, effectively elongates these 3 semesters. You must complete reproductive physiology before you can start any of the specialty work. And it's only offered in that spring semester. So that's just an important thing when, back to this idea of advising, if you're saying, oh, I need to change kind of the number of classes that I'm taking per semester, we need to be working with admissions. We need to be understanding your program plan so that we have that correctly aligned to have you ready to start with these didactic courses or specialty didactic courses that only take place in the fall. So again, we have more wiggle room, if you will, to modulate timing of the core than we do anything else, okay? That's why, again, once you matriculate, Dr. Johnson and I are your advisors. And so we work in partnership with Mark, with admissions to revise any program plans based on your needs. We get it, life happens, but there are certain things we can't modulate. And basically it's the timing of these 4 classes. Everything else we can fudge a little bit, but we can't move around reproductive physiology, and we can't move around primary care of women, gynecologic care, as well as care of the childbearing family, which are your required specialty courses to take and complete before you could do any clinical training. Okay. So the other piece that I want to focus on is once your clinical practicums start, so that's where you are actually out engaging in direct patient care as a novice APRN, in training. And Dr. Johnson's going to speak a little bit more to actually clinical placements, but I'm just talking about the perfunctories of like what has to happen to actually finish your degree. Okay. And so our practicums, there are actually 3 of them. And again, it's a year, it's like a calendar year of training, if you will. So spring, summer, fall. And you can see that this last practicum is a large practicum. And it's the only thing you're doing in the fall by the MS program plan. If you are a DNP learner, that isn't the same. You will have didactic coursework in that semester as well. But that's a busy semester. 270 clinical hours is, more than 1 day a week in clinic. So we'll touch on again, expectations, but it's important to set realistic expectations for yourself. Working full-time and doing this program full-time, whether it's MS or BS to DNP, is very challenging and very taxing. And what is important to remember is your circumstances are your own. However, that doesn't change. If you're enrolled full-time, you're expected to participate in your coursework full-time, okay? So what I'd like to do is also show you the BS. And I think you should be seeing that. Is it still on the MS?
No, it's
Oh, okay, good.
you're on the
Good, 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 good.
ES to DMP.
I know sometimes I mess that up.
Yeah, nope,
So
you're there.
you can see again that this looks very similar until we get into the what would be your terminus clinical semester, that fall of year 2. And here's where we start layering in some other core classes of the doctorate. So we just shared to you that if you are only in the MS program, that's a busy semester. If you're in the DNP program, your final clinical semester is very busy. Okay. You have 6 didactic credits as well as 6 clinical credits. Then you can see where we go through the other pieces that are required ahead of you working on your DMP project. Now, at this point, and I will tell you, it's very common, and you can see that the credit load is lessened than many of your semesters in the MS portion. And that is with the expectation that you will be in a practice setting at that point. DMP projects take place in a practice setting, either your own or a site that you have engaged with. So part of that, you're out there in the workforce, if you will, and then you're also doing your DMP project. And again, it's very important. There are specific DNP webinars that you can attend as well. And I find those very helpful to help you tease out like what's right for me. And you're certainly welcome to reach out to Dr. Johnson or myself. We're happy to discuss that more with you. Both of us were MS and then DMP. So we understand that that is a sequence to do it. And we also have many of our learners are BS to DMP, many are MS. So we understand kind of pros and cons and can, just be a sounding board for you as you explore those. Before I move from this, are there questions specifically about the program plans themselves? Again, these are on our website, as they are for every program. You can see as you've been exploring this since you're here, we are an institution that confers multiple advanced practice degrees. That's exciting, and sometimes it can be very overwhelming because you're like, I don't know, how will I pick? Like, how do I understand what the differences are? And so looking at the program plans can help you conceptualize too, like, well, what else is an FNP taking? What else is an adult gerontological primary care nurse practitioner taking? And it's not secret. We provide that information to you.
Dr. Fisher, there will be a slight change on the DMP project.
That's true. You're right.
On the one, like the 30, 35 will be combined.
Yes, that's super. Thank you, Dr. Johnson. We do need to get our ANAPIN. That's actually a good reminder because that's across programs that everybody's program plan needs to be updated. It's not just our specialty, it's everybody's. Okay, I'm going to go back and share the PowerPoint again. Oops. Okay, so the only other pieces that I want to say about classwork is that sometimes it's surprising to learners that there are some pieces that are required to be synchronous, and there are some pieces that are allowed to be asynchronous in terms of your coursework. And core classes right now have traditionally been asynchronous. However, do not just say, oh, I was told once that they were asynchronous, because we are getting information from the university that we're not allowed to be mixed. Some classes like this advanced assessment, Patho and Pharm do it as well, where we have a weekly class And we have in the past said, well, you don't have to be there live. You can watch the recording. Our senior associate dean for academic programs actually strongly discourages that. She doesn't think it's the same learning environment if, Abby's there in person, Annapin watches it later. And so that is something that may shift between the time that you apply and the time that you matriculate. And so we're putting it out there for everyone because it's a little bit of a shift for us in terms of how we have previously explained, like, oh, you can take advanced patho and do the work whenever you want. That's not necessarily true. There may be group work. There may be a requirement for a synchronous learning component. In the didactic courses, and I apologize because advanced assessment is on there twice. When we have a specialty didactic course, those are synchronous, and your expectation is to be there either in person or on Zoom for the duration of those courses, or class meetings. They're not recorded. And sometimes, like in emergency situations, you tell me, like, I have to do my ACLS research. I couldn't do it any other time than Wednesdays. We'll work with you on that. However, the goal is that you mark Wednesdays as, so that's the class timing bullet. Your specialty classes at this point are on Wednesdays. And again, might that be in person? You will have an option to either select in person or Zoom for those courses. The other thing that happens in the fall and then again in the spring of your specialty work, your specialty classes, is that there's intensive gathering. So this is most important in the fall, because in the fall, so those learners that are starting specialty work this fall have 3 in-person days, full days in person, in that first week of the semester. In the second semester, in the spring, they will have a 2-day in-person skills class that they will do in the first week of the semester. So also earmarking the first week of the semester for kind of more intense, again, you may have an online option. It is definitely in person for the specialty work. But that first week of the semester, sometimes there's extra intensive work. And that's true. So I get to double dip and talk to you about a core class. Dr. Johnson and I both teach in the core. I oversee the advanced assessment course. And this course is considered part of your core, but it is truly hybrid. So there will be a requirement for you to come in person during that course for labs and testing. And so there are a lot of moving parts to that course, and it's very important. For instance, I had a learner reach out to me 2 weeks before the course started and said, oh, I'm so sorry, I can't be there for these in-person dates because I'm getting married. That's not an accommodatable request in assessment. Unfortunately, like, the dates are the dates. And so what ultimately happened was she had to drop out of the class for the summer, and we'll take it in the fall, which is fine. I mean, again, like, congratulations, that's wonderful. But we just need you guys to understand that it's not always possible for us to accommodate some of the wonderful life experiences you're having, right? And we also understand things do happen. People get married, people have babies, they still complete their programs. They have injuries that take them out for a little bit. So we will work with you. There are certain things, though, that can't always be adjusted for. So I just say that because sometimes people say, I never heard that I would have to be in person for advanced assessment. And I promise, we tell you, we repeat it in the admissions meeting if you choose to apply. We repeat it once you matriculate, but sometimes it just fizzles out of your head, and we understand there's a lot of things, competing for priority. So that's really what I want to say about your academic or didactic coursework. First, I want to see if there are any questions, and then I'm going to hand it over to Dr. Johnson to talk a little bit more about the clinical training side of things. And then I also want to make sure, Annapin, I understand a bit, because I see 38 already, how much time you need to go through your piece. 15?
15 is good.
Okay, so Dr. Johnson, you're going to be quick.
I'm going to Zoom. Okay. All right. Well, and I get the privilege of also teaching advanced practice roles, which is at the end of your first year, I believe. So that is a class where we teach you how to become an RN and learning how to advance yourself in to being a nurse practitioner. So that is always a fun, eye-opening class, and I love to teach that. So once we get you into all those core classes and get you past that, then you start to plan for clinicals. And in usually the spring, we have a skills class, and that is where you review your breast exams, your pelvic exams, male exams. You learn IUD insertions, you learn suturing, you learn Nexplanon, you learn endometrial biopsies. So, and that is a class that you need to be on campus for. So it's a very hands-on class. And then we also offer a wet prep course during that intensive week as well in a special lab. So I want you to know about that. And that's usually on the Thursday and the Friday of that intensive week in the spring. So let's talk about clinicals a little bit and how those come about. It's never too early to start planning clinicals once you are accepted in the program. If you have special offices and special providers that you know that you would like to work with, it's never too early to approach somebody and say, I'm going to be in this program, and would you be interested in being my preceptor? Now, I say that in that we have a team approach in finding clinical placements. Years ago, when I first started this position, we advertised, we will totally find your preceptor for you. Times have changed. Preceptors are very, very in demand, and we just don't have enough preceptors in the US. It is a problem nationwide, so we're always recruiting new preceptors. The best way for us to find you a solid preceptor and to have things in place, it's with our ELT team, our experiential learning team. It's you and Dr. Fisher and I. And what our roles in that, I always say you are the ones out there in the workforce. So you have that one-to-one contact. Again, when I first started this position, I would go to offices, I would go to clinics, but times have changed. And especially with COVID, HIPAA is more pronounced, and just offices don't want extra people coming in and trying to meet with their providers. So this is where our ELT team, we have Kristen New, and she has a team of people that really help us with the affiliation agreements and making initial calls, etc., and really tapping into those contacts that you have. How Dr. Fisher and I play into that is that we then use our expertise in working with those providers to say, Abby is a new student in our program. She needs A, B, and C, and this is her focus. And here's our skills list. And here's the evaluations that she'll be being used in our program. So that is with the 3 tiers then. this is how we find solid placements. And like the PowerPoint says, it's never too early to plan and connect. We have people now that will be taking our GYN course in the fall that are already planning their spring clinical placements, which is just wonderful. So this system really works. And I can't say enough about our ELT team. We have what's called direct and indirect hours. I'll briefly talk on that because we need to give Anna Penn time to talk, and Dr. Fisher wants to talk about Guatemala. So according to our National Certification Corporation, who provides the certification exam, you need 600 direct clinical hours. And what that means, that's the time that you are in clinic with your preceptor. And that can be included in that can be your prep time. That does include lunchtime. If you go into clinic at 7 and you leave at 5, those hours are all counted towards direct hours. Indirect hours would be things like conferences that you go to that we would approve, that you can go to. Maybe there's a webinar that you want to look at. Something like that would be indirect hours. And that's usually maybe 30 hours, sometimes more. But your direct clinical hours, there's no wiggle room in that. It can be more. We do often have students that have more than the 600 hours. Yeah. So Dr. Fisher, you want to talk about Guatemala?
I'll just briefly say that we are working on enhancing our study abroad opportunities, a clinical immersion, and we are doing the first one for nurse midwifery and WHNP learners predominantly this fall. So ideally it would take place in your third clinical semester. And hopefully there'll be even more opportunities, but right now Guatemala is the site that we're working with, and Spanish speaking skills are required. So you're welcome to reach out to me and I can talk more about that, but I really want to turn it over to Anna Penn at this point and have her thoroughly go through the admissions pieces. Thank you, Dr. Johnson, for all of the clinical information.
Sure. I'm sorry, a call came in. I'll be right back.
All right. Dr. Fisher, would you like me to just try to see if my slides will work? Otherwise, you could
tell
just
me to advance at
the
this
next
point,
one.
just
Yeah,
for
advance to the
time.
next slide. Yeah, sounds good.
Oh, now I'm not advancing. There we go.
Okay. All right. So let's talk about the admissions requirements. For the Masters of Science and the BS2DNP, we require your BSN with a minimum 3.0 GPA from a regionally accredited institution. Your BSN must come from a CCNE or ACEN accredited institution. And then same with your MSN, that is if you were going to apply for the postgraduate. But I think everybody here are interested in the MSN or the BS2DNP. And speaking of, if you would like to learn more about the DNP program, as Dr. Fisher mentioned, we do have a DNP webinar that's available as well. And if you're up to it, we do have one next Thursday from 5 to 6. So that's my plug right there for the DNP webinar. And then for the prerequisites requirements, you would just need to get inferential stats as well as a nursing research course. And then for the applications, we use an online application called NursingCast. Everything must go through NursingCast. So you would apply, there's an application fee. We will need to see official transcripts from every school you've attended. Even if you took a class that's not relevant to nursing, we still want to see it. So all of your transcripts are sent directly to NursingCast. In regards to the application fee, it is $130. $80 goes to NursingCast, and then there is a $50 supplemental fee to CU, and then whatever additional cost may be to get transcripts sent to NursingCast. We also require a personal statement, which there'll be prompts for you to articulate your passion and your goal about why you're interested in this population. and then 3 recommendations. Of the 3 recommendations, we ask that one be from an academic reference, so your instructor, your mentor, and then the other 2 would be from a professional references, so somebody in a supervisory role, whether your supervisor, your manager, a charge nurse, what have you. So a total of 3 letters, and then a CV or a resume, and then a copy of your current unencumbered RN license is required as well. Next slide, please. Also, as Dr. Fisher mentioned, we do accept transfer credits. If you have taken some of the courses, we may be able to accept them, just like the prerequisites for inferential stats or nursing theory would come in as prerequisites. But if you're looking to transfer any credits, we do accept a maximum of 12 credits, maybe transferred. For the review process, we will need to see your transcripts as well as syllabi, which we will then forward to our CU faculty members to make sure the courses are equivalent to our courses. But you must have a B- or better to transfer. And in terms of the advanced pharm, I think because this is a MS and VMP, it's not required, so I'm not going to touch base on that. Same with the transfer. So I think we will skip this part because I think everybody will still need to take them. If you would like to take courses prior to being officially admitted, you can do so. You definitely can, and you could take these courses as a non-degree. Right now, our application for non-degree is open until August 4th if you're interested. Theory, EBP, informatics, policy. So for fall, I believe theory, EBP and informatics are offering in the fall semester. So if you are interested in taking them prior to applying to Women's Health, feel free to fill out the non-degree enrollment form. But it is subject to space availability. So the sooner you apply, the sooner you could your name up there on the list to have space availability. And again, it will count. It will apply towards your MS or your BSc-DNP curriculum. The downside is taking courses as a non-degree, you're not eligible for financial aid, and taking the courses does not guarantee admission into the program. But it will definitely lessen your coursework for when you do start the program. So that's a little highlight there. In terms of the application, there's 2 dates. There's a prior deadline and there's an extended deadline. And our specialties will vary based on what, and for women's health, we do have application, and that's going to be in the next slide. But applying by a prior deadline guarantees that your application will be reviewed. Okay, but those are the lines. And right now for spring semester, if you are ready, we are opened until September 1st. For spring 25, if you are ready. So if you're thinking, okay, maybe I want to take some non-enrollment courses in the fall, knock out some few courses, and then apply to start in the spring, you're just in time. Okay, next slide, please. And so with women's health, see, we don't have a spring term, not for the MSc-DNP. I apologize. But that just means you
That's
have
not
more
true,
time.
Anna Pin. Your slide isn't up to date because that's what we just added in the spring. We just voted to add it back in.
Thank you, Dr. Fisher. Well, just kidding. So
what you said was correct. You're just correct.
Okay, so you are ready to start in the spring. Feel free to do so. I'll let Mark know to update this. So we'll just go ahead and we don't need to worry about post-grad certificate. I feel like everybody here, was in Colorado, right? In state? Because we don't have to worry about this either. Because if you're out of state, then that's there are certain stipulations where we have to consider where you are residing and then not be able to admit you if you reside in certain states. But if everybody here is Colorado residents, we have no issue. It'll be a non-issue.
But if that would change during your program, if you were to move and then wanted to do clinical training elsewhere, we do need to know that.
Thank you. All right, tuition costs. So because we're residents, right now the current cost is $785 a credit. If you're thinking of doing the master's program, as Dr. Fisher showed you, it's about 50 credits. 35 of it, as you saw, were didactic, and then 15 were clinical credits, so a total of 50. So if you do the 785 times 50, would give you an idea of the tuition costs. And for yeah, we don't have a non-degree. And then, so we're looking at credits that vary. So the MSN is 50 credits. The BSTDNP is about 76 credits total, as you saw on the curriculum. And and again, because we're resident, we don't have to worry about the the WHI and the Western Regional graduate program, because for that, usually you'll get in-state tuition as well. But if you're a Colorado resident, you're already going to be charged in-state tuition. In terms of financial aid, it is available if you qualify. And in terms of scholarships, we administer our own scholarship process. And typically about 15 to 20% of students will receive some sort of funding from the college. And when we launch the application, we'll send a mass email for a call out, and then all students will have the opportunity to apply. But in addition to internal scholarships, we do have external scholarships available for you to apply for as well, and it's linked to our website. So if you go onto the website, you could look for external scholarships in addition to applying for CU scholarships. And then if you are employed, everybody here is employed, sounds like, speak with your employer to ask about the tuition reimbursement program, because that's going to come in handy. Every little bit helps, right? So if you want to maximize your funding, is tap into the tuition reimbursement program, apply for financial aid and for scholarships. And then to apply for financial aid, fill out the FAFSA, and it's every year. And you'll be eligible for loans. So there's a federal Stafford loan as well as federal plus loan. For the federal graduate loan, you have a maximum of $20,500 per academic year. And right now their interest rate is at 7.05% with a 1% loan origination fee. To subsidize your federal Stafford loan, because you could borrow up to $138,500 in your lifetime, and that includes your undergrad studies. So if you have taken loans out in your undergrad, that's going to count towards the $135,500 in your lifetime. But you could borrow up to that amount. And then to supplement it, if you're close to maxing out your lifetime aggregate, you could supplement it by applying for the Graduate Plus loan. It is at a higher interest rate at 8.5% with a higher origination fee at 4%. But if you're interested in getting more financial information, certainly scan that QR code to bring you directly into our financial aid website. Once you apply and become admitted to CU, you're part of the CU family. Obviously, we want you to be successful, and working with Dr. Johnson and Dr. Fisher, you're all in good hands. They are fabulous. And so, we want to be supportive. And so we have a library that's open 24 hours and robust online resources, articles, texts, whatever you may need, the library is great. We also offer academic success coaching just to help you. And there are teaching assistance opportunities. We are DEI committee that's open to students, faculty, and staff. And then I know Dr. Fisher had mentioned the Guatemala experience. And just to get more information, certainly scan on that. And I believe that might be it. Any questions you may have, feel free to email nursing.admission. This is a catch-all email, but if you want to specifically talk to Mark, he is the liaison for the master's program, Women's Health. I'm just filling in today because he couldn't be here. But yeah, feel free to reach out to Mark or the nursing admissions. So, and that is it. I know that was quick just because of your time, but I want to leave a few minutes.
I'm impressed. Yes. So first before we let you leave, we want to make sure, are there any specific questions? And then we can address that.
Yeah, if you could just clarify were you saying that the spring there is a women's health program that you can get into for the spring, or it's just fall of 25 basically?
So there is still spring of 25 admission cycle is open still, and that is effectively extending your core to 4 semesters instead of 3.
Okay.
So it spaces it out a little bit. But then you would start your specialty work still in fall of 26, which is the same as if you entered in fall of 25. So those program plans are you can review that if you go to our women's health specialty. It does have the spring admit for both programs to show you what that slight variation is. And then Eliana, the PGC, the post-grad information is listed on there as well. That program plan. And then also that gets slightly customized dependent on what you're coming in with. If you are coming in as a PGC who actually doesn't already have a nurse practitioner, you're pretty much doing all of the MS. If you are already a nurse practitioner, let's just say you're adult, your AGPC, then that's where that program plan is fairly accurate. And then we have a discussion about transfer of clinical hours and what that would look like. So that involves a little bit more review with Dr. Johnson and myself, but that will at least help you understand kind of how a PGC looks versus some of the other degree plans. Does that help?
Yeah.
Thank you so much.
Perfect. Good. Because I know it's like same and different. It's not exactly and it is hard because there's customization that comes from that too. But that's a great question. Other questions or things that I know we went fast. So okay. Well, then we can stop the share for now. We're exactly at our 1 o'clock point. And the only other thing that I will say is as you're pursuing graduate studies, specifically in the area of women's health, and there are like the nurse corps, there are loan repayment programs, but that you have to apply for and qualify for. If you're interested in working in a lower resource setting, a federally qualified health center, those are not necessarily low resource, but there are opportunities for different repayment programs that, again, they're an application. So that's not why we don't list them as eligible to all, because of it's not necessarily a guarantee, but those are other options for looking at ways to repay once you're there. Okay. Well, we appreciate you taking the time to be here today. We enjoyed meeting you, Eliana. I know you came in a little bit late, but we're so excited that you joined. So again, if you have questions that come to your mind, Jennifer.Fisher@CU-Anschutz, Linda.Johnson@CU-Anschutz.edu. I left that off of mine. And then Mark is really as Anna Pin shared, our point person in admissions. And he can be incredibly helpful in all of the lead up to submitting that application. Right? So please take good care. Thank you so much for being here. I'm going to stop it.